The Taiwan Model. The Secrets of Taiwan to Conquering the Coronavirus, COVID-19. Episode 2. The whole story started here. The unforgettable tragedy of SARS in 2003. The defeated Taiwan. As of today in February 2022, as we have mentioned in Episode 1, the Taiwan Model has successfully protected Taiwan against COVID-19 coronavirus. In fact, the Taiwan Model was not established only after COVID-19 emerged in the world in late 2019. Surprisingly, the Taiwan Model has been taking shape since year 2003. The Hospital H, located in downtown Taipei, was the epicenter of the tragedy of SARS in 2003 and was the place that gave birth to the Taiwan Model. Initially, in late December 2002, it was reported on the internet in China that a strange disease was spreading quietly in the Guangdong province. Patients were said to be suffering from high fever, coughing and other symptoms, which soon deteriorated into respiratory failure and death. The death rate of the disease was about 10%, which is much higher than any regular flu. It quickly caused a stir in the community. However, the cause of the disease was unknown. The route of transmission was unclear, and the cause of the rapid death cannot be identified, let alone effective treatment. Initially, government officials of China did not reveal the outbreak of the mysterious disease until the situation was on the verge of spiraling out of control. Later, on February 10, 2003, China reported to the World Health Organization that an outbreak of acute upper respiratory disease in the Guangdong province had turned into atypical pneumonia and resulted in deaths. What was unique about the disease was that 1/3 of those infected were medical personnel. The atypical pneumonia was later named as SARS, standing for the Severe Acute Respiratory Syndrome, which is caused by the SARS coronavirus. There were also other types of coronavirus discovered before, but SARS coronavirus was the first lethal coronavirus identified in history. Later, SARS spread into Hong Kong from Guangdong by a traveler. He was soon hospitalized in Hong Kong, and consequently he spread the SARS virus widely within the hospital and the hotel, resulting in the outbreak of SARS in Hong Kong. From there, the SARS virus further spread to Hanoi, Singapore, the Philippines, the United Kingdom, the United States, Toronto, Vancouver, and then back to China itself. Taiwan, being located only less than 200 kilometers from China across the Taiwan Strait, had more than 200,000 businessmen living and working in China in 2003. They frequently traveled between Taiwan and China. Despite knowing the SARS outbreak in China, we were not really worried about that. Why? Because we knew that Taiwan's public health and medical care systems are among the best ones in the world. Truly, medicine is one of the few things Taiwanese people are very proud of about our country. Just to name a few, the world-class achievements of Taiwan in public health and medicine in the past decades include: in 1960, serious infectious diseases such as smallpox, cholera, plague, rabies, etc. were eradicated in Taiwan. In 1965, Taiwan was declared a malaria eradication zone. In 1968, Taiwan completed the first successful living kidney transplant in Asia. This was a very advanced achievement, even in the whole world. In 1979, completed the successful division of a triple-limbed abdominal sciatic and joint twins. It was the first case in Asia and the second in the world. In 1984, completed the first successful liver transplant in Asia. In 1986, completed the division of the world's smallest thoracoabdominal conjoined twins. In 1987, Taiwan adopted the definition of brain death and became the first country in Asia to legislate for brain-dead organ transplantation and enacted the Human Organ Transplantation Ordinance. In 1987, completed the third heart transplant in Asia. In 1989, completed Asia's first heterotopic heart transplant, double-hearted. In 1994, set the world record for successful splitting of the lightest thoraco-abdominal conjoined twins. In 1995, the Taiwan National Health Insurance was fully implemented, which combines medical, dental, mental, etc., all in one insurance for all Taiwanese people at very low fees. In 1995, completed the world's first operation on a giant intracranial aneurysm under hypothermia and cardiac arrest condition, with the aid of ECMO extracorporeal circulation. In 1996, completed a heart transplant using a Taiwan-made artificial heart. The first case in Asia. In 1997, completed the world's first living liver transplant without blood transfusion. In 1998, completed Asia's first second-time lung transplant. In 2000, completed the world's first three-hearted transplant. It was performed using two hearts from different sources with the aid of ECMO extracorporeal circulation. In 2000, completed a heart transplant at the youngest age in Asia, 5 months old. In 2000, in the worldwide health rankings published by the British The Economist magazine, Taiwan ranked second in the world after Sweden. In 2001, completed the world's first skin stem cell transplantation operation to the cornea. In 2002, completed Asia's first kidney transplant for a child under 10 kilograms. In 2003, when Taiwan was ready to set more world-class records in medicine, SARS suddenly came. Having enjoying Taiwan's high-level medical care for decades, we Taiwanese thought SARS is obviously causing a major problem in China, but, it probably won't be a big issue in Taiwan. While we were just thinking about that, the cruel trial arrived. In mid-March 2003, after China and Hong Kong have fallen into SARS, a businessman coming back home to Taiwan from China was diagnosed as the first SARS patient in Taiwan. At the beginning, the spread was still contained within his family and a local region in the hospital. Everything seemed to be under control. Doctors even performed the world's first lung biopsy puncture on one SARS patient to study the change of the lung tissue. However, over time, the situation was getting worse. In April, out of nowhere, more and more suspicious SARS cases were reported from various hospitals in Taiwan. The situation seemed to be out of control. Now, we desire more clinical knowledge about SARS, which can help us better identify SARS patients. We also desperately need the SARS virus strain, as we cannot develop useful treatments without knowing more about the SARS virus itself. We then asked the World Health Organization for help. The World Health Organization said, Taiwan is not a member state of World Health Organization. You should ask China for help. We asked China for help, but got refused. We then turned to Hong Kong, but eventually Hong Kong declined, saying that we are willing to provide you with the SARS virus strain, but we did not get the final approval from China. Without getting any help from those who have been dealing with SARS for a few more months than Taiwan, the situation in Taiwan deteriorated very quickly. On April 24, 2003, the Taipei city government suddenly sealed off a city-owned large hospital, the Hospital H. Nearly 1,000 medical personnel, patients, visitors, etc., were all locked in the hospital without any notice beforehand, and they were not allowed to leave the hospital within 14 days. The off-duty doctors and nurses were even asked to come back to the hospital to be locked in and provide medical service. The reason was that the Hospital H was clearly having an outbreak of SARS due to uncontrollable virus spread in the hospital, so they have to be isolated therein. The decision of the Taipei city government is disputable, and this immediately caused an uproar in the society. From the TV news, we saw nurses holding signs in the window, protesting the crude decision. The lockdown of the hospital does not come with any plan. There are lack of personal protection equipment in the hospital, and the infection control there is out of order. Nobody knows whether he or she will be the next to be infected by SARS. The whole nation was watching the development in Hospital H from day one. We all panicked. Finally, Hospital H was unsealed on the 8th of May. As the result, 57 medical personnel in Hospital H were infected, of which 7 died. 97 other people in the hospital were infected, of which 24 died, including one who killed himself. This made Hospital H the single most deadly spot of SARS in the world. Many who walked from Hospital H called it a hell. A few nurses thereafter even suffer from long-term mental illness. Yet, the spread of SARS in Taiwan was not over. More and more hospitals and local communities had fallen to the virus. The sense of worry, anxiety, fear, and despair about SARS was pervading the entire Taiwan society. It seemed there was no way out. Eventually, the US CDC gave us the SARS virus strain and sent a group of experts to Taiwan to work with us shoulder by shoulder. In mid-June 2003, the SARS epidemic in Taiwan was finally under control. At the critical moment of Taiwan, the United States of America was our only true friend, who flew across half of the globe and came to Taiwan to help us out. We are grateful for that. At the end of SARS, totally, 346 people were infected and 73 died in Taiwan. Globally, Over 8,000 people from 29 different countries and territories were infected, and at least 774 died worldwide. On July 5, 2003, the World Health Organization finally removed Taiwan from the list of SARS-infected areas. Taiwan, sadly, was the last country removed from the list. Moreover, SARS became a nightmare deep in every heart of Taiwanese people, and the trauma caused to the society will probably never be healed. Taiwan was knocked down by SARS heavily. We knew there is a lot to improve, and we knew there is no organization we should expect to rely on. Since Taiwan was forced to quit the United Nations in 1971, Taiwan was no longer a member state in all the 15 organizations belonging to the UN, including the World Health Organization. For decades, Taiwan does not enjoy any of the rights other countries in the world enjoy. For decades, we, the 23 million Taiwanese people, have been left out of the international community, and people there pretend they don't know that. We are like orphans in the world. When you fall down, you stand up only by yourself. Being surrounded by the rubble left by SARS, the Taiwan government and the Taiwanese people vowed to ourselves. Whatever it takes, we will build up our own national immune system from ground zero. Whatever it takes, we will never let SARS knock us down the second time. When SARS strikes again, we will stand tall. If you find the information interesting and useful to you, please like, subscribe, turn on the notification bell of this channel, and share the links with your friends, your government officials, and media in your country. Thank you, and don't forget to get vaccinated if you have not. In the next episode, you will see how Taiwan reconstructed the national immune system by legislation immediately after the tragedy of SARS. The post-SARS legislation, regulation, and administration formed the solid foundation of the Taiwan model today. We will see you next time.